Right, so today we're going to do some kinesio taping on our patient here. Reason is because he's a swimmer and he's been having problems around the shoulder and neck area, and one of the treatments that we can do is address his posture of his shoulder. And as you can see, like a lot of people today, he's got quite an anterior rotation to his shoulder, and it's also very common in swimmers that do a lot of front crawl. So kinesio tape is one of the many tapes that you can get. Is a more of a proprioceptive and kinetic type of tape. It's not rigid, and it's used to just give Adam a little bit of feedback to remind him to just sort of alter the angle of that shoulder to bring it back into a correct posture that will open him out and hopefully give him a better rotation when he is swimming, but also to try and address some of the irritation that he's getting in his upper back and neck. So, right, so we start with just measuring him up, and we're actually going to do some taping at the back around the shoulders. So I've measured him up to here. I've got one piece that I've done earlier, so I'll just cut that to about the same size. With this type of tape, we always round off the edges. If we don't round off the edges, it will just peel off within a day. So rounding off the edges just helps secure it. It's nothing more than that. And just sort of tidy it up a little bit. Kinesio tape's got a low rate of allergy. We've already tested this patient for allergies. So really what we want to do is, first of all, align Adam up. Ask him to sit in the best posture possible. So I sort of say pull up. Imagine you've got a book on your head. Lovely, great, fantastic. And first of all, I just peel off a little bit of this tape. You can see it's very, very stretchy. It is not like rigid bracing tape. And actually, what I am following is more of a sort of lower trapezius type muscle. So you follow a muscle line. So we then ask him to rotate forward, just your shoulder. That's it, not twist. That's lovely. Put it on, stretch and tape to there, and just smooth it off. And actually with heat, and then bring it back. And the heat will actually help set it, and there's quite a strong glue on the back of these pieces of tape. So, right, and we then again do the other side, because with any sort of functional type of correction, you want symmetry. You want right equaling left, left equaling right. Now Adam actually does have a little bit of what looks like sort of a type of eczema there, so you really want to be careful with things like that. But I think he'll be fine because we've taped him before. So again, rotating that shoulder, lovely, thank you. Putting it on stretch, smoothing out, bringing him back. So really this is working on proprioceptive receptors that engage in the skin. It's not, like I say, about him being rigid here, because that's not going to be realistic in his everyday life. So that's just some simple kinesio taping. We've given him, prior to this, an allergy test and also precautions of how to take this type of tape off, and also advice on how it will work, and hopefully that will be part of Adam's treatment, more sort of 24/7 type of treatment that will help him alter his posture and relieve some of the aches and pains that he's having.